Hepatitis B is an infectious disease caused by the hepatitis B virus that affects the liver. It is a type of viral hepatitis. It can cause both acute and chronic infection. Many people have no symptoms during an initial infection. In acute infection, some may develop a rapid onset of sickness with vomiting, yellowish skin, tiredness, dark urine, and abdominal pain. These symptoms often last a few weeks and initial infection rarely results in death. Once infected, it may take 30 to 180 days for symptoms to appear. Among those infected around the time of birth, 90% develop chronic hepatitis B, while less than 10% of those infected after the age of 5 develop chronic cases. Most of those with chronic disease have no symptoms. However, cirrhosis and liver cancer eventually develop in about 25% of those with chronic HBV. The virus is transmitted by exposure to infectious blood or body fluids. In areas where the disease is common, infection around the time of birth or from contact with other people's blood during childhood are the most frequent methods by which hepatitis B is acquired. In areas where the disease is rare, intravenous drug use and sexual intercourse are the most frequent routes of infection. Other risk factors include working in healthcare, blood transfusions, dialysis, living with an infected person, travel in countries with high infection rates, and living in an institution. Tattooing and acupuncture led to a significant number of cases in the 1980s. However, this has become less common with improved sterilization. The hepatitis B viruses cannot be spread by holding hands, sharing eating utensils, kissing, hugging, coughing, sneezing, or breastfeeding. The infection can be diagnosed 30 to 60 days after exposure. The diagnosis is usually confirmed by testing the blood for parts of the virus and for antibodies against the virus. It is one of 5 main hepatitis viruses, A, B, C, D, and E. During an initial infection, care is based on a person's symptoms. In those who develop chronic disease, antiviral medications such as tenofovir or interferon may be useful. However, these drugs are expensive. Liver transplantation is sometimes recommended for cases of cirrhosis. Hepatitis B infection has been preventable by vaccination since 1982. The World Health Organization recommends vaccination in the first day of life if possible. 2 or 3 more vaccine doses are required at a later time for full effect. This vaccine is about 95% effective in preventing infection. About 180 countries gave the vaccine as part of national programs as of 2006. The WHO also recommends that all blood be tested for hepatitis B before being used for transfusion, and that condoms be used to prevent infection. In 2016, the WHO set a goal of eliminating viral hepatitis as a threat to global public health by 2030. Achieving this goal would require the development of therapeutic treatments to cure chronic hepatitis B, as well as preventing its transmission and using vaccines to prevent new infections. About a third of the world's population has been infected with hepatitis B at one point in their lives. At least 391 million people, or 5% of the global population, had chronic HBV infection as of 2017, and another 145 million acute HBV infections also occurred that year. Over 750,000 people die of hepatitis B each year. About 300,000 of these deaths are due to liver cancer. The disease is most common in the Western Pacific and African regions. Infection rates are 1.6% in Europe and 0.7% in the Americas. Hepatitis B was originally known as serum hepatitis.